Welcome, I'm Iowa City Mayor Bruce Teague. This is Community Connection, where we highlight the work of our community partners during the coronavirus pandemic. 1 in 4 women and 1 in 6 men will be affected in their lifetime by intimate partner violence. Sadly, the current conditions that are keeping us at home can cause rise in tension and at times are likely to increase the incidence of domestic disputes and abuse. I have 2 guests joining me to discuss this topic. Kristie Fortmann-Doser is Executive Director of the Domestic Violence Intervention Program, also known as DVIP. We've also got Sergeant Scott Stevens of the Iowa City Police Department with us. Thanks both of you for joining me today. Kristie, I'm going to start with you because DVIP has been in this for 40 years, and I know that you all have a lot of regular services that you all provide. Will you give us a little bit of information about the services that you all provide on a daily basis?
You bet, absolutely. The Domestic Violence Intervention Program provides crisis intervention services for victims of domestic violence, dating violence, stalking, and human trafficking. We work really hard to provide comprehensive support and advocacy, and our biggest goals are immediate and long-term safety, empowerment, dignity, and hope.
I'll tell you that that is something that within our community is very appreciated, because just to have an agency that is committed to the prevention of violence and even doing some things to track it is quite important. So during this pandemic, you know, there could be this potential surge of domestic violence, and how are you all a part of that in trying to prevent it? So if you can talk to that a little bit.
I think that our services being crisis intervention, most people are aware that we have a hotline and that we have an emergency shelter. And during the pandemic, those are what we call our baseline services, and they are absolutely still in place. They look a little bit different in that our crisis line is also being supported by the statewide hotline, and that our emergency shelter is really about how do we social distance and create opportunities to keep people safe and diminish exposure for COVID. I think that the other piece of this, the really critical piece of this, when you move beyond the emergency support, is just how is it that domestic violence is impacted by stay-at-home orders and social distancing as a whole. And it has a significant impact. For many individuals who are battered by an intimate partner, being isolated with them over a long period of time actually increases danger. And it is something that you don't have the same capacity to separate from somebody. You don't have the same capacity to protect your privacy or to reach out for support in an environment like we live in right now.
One of the things about the environment, when you're talking about people staying at home, and because of COVID-19, there are some people that have lost their jobs. So that mental stress, you know, could be weighing in on someone. And whenever you put financial in there on top of, you know, being with someone that you're with them all day at this point, you know, in some situations, that increase of violence or just frustration, you know, can increase. And so I think one of the things that I'm hoping to do with this today is just to make that awareness that the stressors of this time can be not only financial, but it can be somewhat frustrating, even when you have to see someone all day, and if they're eating the, you know, chips, crunching it loud, that could be kind of a trigger for you. And, you know, maybe you say something that makes the other one mad, and it's little things that can really be created into something bigger. And so that's one of the hopes that I want to do here, is just to bring that awareness that during this time, it can be some little annoyances that can really trigger some confrontational behaviors. And so just be mindful of it, and, you know, maybe approach it in a different way when you're wanting to deal with something that's kind of annoying, and just to let the individual that you're living with know that, hey, I can hear your chips louder than the TV right now, and it's driving me nuts. And so maybe put a little humor to her. But certainly during this time, we do see an uptick. And I know that Sergeant Stevens, you're with us, and I so
Yep.
appreciate all that you are doing with the police department. Can you talk a little bit about your relationship with DVIP and what your officers are doing during this COVID-19 and with the domestic responses?
Yeah, absolutely. And I appreciate what Kristie has to say. This, we have to recognize that for sure, for a certain part of the population, this is their living hell, being trapped at home with their abusers. And so, as a department, we recognize that a lot of the services we provide and what we do to investigate domestic violence and provide safety for victims and their families looks the same. It is the same. We have certain mandatory laws that we have to enforce with domestic assault and those types of things. And with that comes no contact orders and, again, safety for victims and their families. But ultimately, our officers are having to be more than ever a little more creative with problem solving in light of the COVID-19. So certain things they're doing are finding ways to interview parties if they don't have to go into the residence. Let's say one of the other parties is calling in the complaint and is willing to come out and talk with us. If we don't have to go into the residence, we're not doing that. And then certainly we're still seeing the same stages of the investigation move forward. When there's an arrest that has to take place, we've got to do that. But we also know that the jails are trying to keep people out of their systems for as short a period of time as they can. So we know that we need a safety plan with those victims right then to be prepared for that person maybe to even get out of jail the next morning, when in other times that may not happen. So again, you see some creativity and some troubleshooting and some problem solving from officers in a different way than we've done in the past, but still bringing that high level of service so that we can provide that safety and freedom and for victims and their families.
So you just mentioned when an individual does go to jail, with our court systems being closed right now, how does that play out as far as like someone being able to file a complaint and the follow-up, from that complaint, where to be brought
Sure.
to in front of the judge?
Sure, and I'm glad you asked that question. That's a very important piece of safety for many victims and their families. Keeping the criminal justice system just outside of what they want to do to provide themselves safety. So they seek a no contact order, whether we're talking about domestic assault, but there's sexual assault and elder abuse. And actually, they've restructured the processes for obtaining that order just a little bit, not a lot. Mm-hmm. But victims no longer have to get their application or their petition notarized before it goes before a judge. And so those forms can still be filed in person at the courthouse using the appropriate social distancing, and the courthouse will work as best they can with victims, but they can also be done electronically. So people need to know that if that's a resource they need to use or that they are seeking more information about, the courthouse can still help with that. They can call the 356-6060 and talk to someone there to help guide them through. And in fact, on Mondays, Wednesdays, and Fridays, there's an access to justice coordinator, mm-hmm. a person that's specifically available to people seeking protective orders and may have questions or need assistance going through that process. But it's still there. It's still a very valid and appropriate and strong resource for victims and their families. Just a little bit different in terms of what it used to look like. And maybe Kristie has more to add as well.
I think the thing that I would add is that the resource and support to talk through the process and to figure out what the best option is for you still exists. We have our local hotline, 319-351-1043, and our statewide hotline, 800-373-1043. Those numbers give somebody the opportunity just to sit and talk through what's happening, how it's impacting them, and then how to access the systems in our community, because it is quite different. There's no question, and it can be quite intimidating. I think one of the hardest things is that for many survivors, when they take that initial step to connect with somebody or to reach out for support, Anything we can do to diminish the barriers is really, really critical. The court systems have worked really, really hard to try and make it as seamless as possible. But the minute somebody hears that something's changed, it tends to slow them down. And so what we really want to try and reiterate is that that hotline is still available 24 hours a day, just to talk through and find out what option is going to be best for you. I think that trying to navigate systems during this time probably seems really crazy and intimidating. And we're really, really lucky in our area to have many nonprofits and law enforcement and health services professionals that have a good appreciation and understanding of the additional barriers that victims of violence face in this time period. And they work really hard to make sure that their avenues to support are as open as we can make them.
So Sergeant Stevens, the Iowa City Police Department was one of 6 departments within the entire nation who received a grant to become a model to prevent bias when responding to sexual assault and domestic violence calls. Tell us about that work and how it changed the department's response, especially when we're talking about individuals calling and feeling invited to call.
Yeah. No, we were fortunate. In 2018, we started the grant cycle from the International Association of Chiefs of Police to improve our response to domestic assault, strangulation, stalking, in addition to sexual assault. But the interpersonal violence component of our work at the police department, a lot of what we did was, it's if you've heard the expression, the whole is bigger than the sum of its parts.
Mm-hmm.
We did a lot of small things in the process of in almost 2 years, working closely with our community partners. And I have to give Kristie credit. Without our community partners, we would not have been able to have the successes that we saw with the work we did during that grant cycle. And certainly DVIP was a huge part of that, but also all of our community partners. And as Kristie mentioned, people in Iowa City are very fortunate, as is the police department, to have such strong, vibrant advocacy services for victims. We're really a gem, I guess, unique in that way. But really, again, the bigger picture is that we began to change our culture at the police department, or shift our culture, not necessarily change. I feel like we've always been focused heavily on domestic violence in this community. We've had a partnership with DVIP for Kristie, 23 years now. So since the late 90s, right?
Mm-hmm.
So we've worked very, very closely, and it's not just with working with victims. We also have the county attorney's office as the third sort of leg of the approach. So we've got the advocacy and law enforcement together, meeting with victims, providing safety, holding offenders accountable, and then giving the best package to the county attorney so that they can move forward with the victim at the front of what we're doing, hopefully, and holding those offenders accountable. But it was a lot about changing the culture of the department through training. One of the things that retired Chief Matherly at the time wanted to do was change our mission statement. And that's really kind of who we are as a department. It's also includes our values, but our mission statement is to work in partnership with the community, enhance trust, protect with courage and compassion, and empower victims of crime through excellence in service. And so we're continuing to do that. That's a culture thing. That's a big picture thing. That's what every officer can look to say, how am I going to handle this situation? How am I going to go one step more than I used to have to do for my community in light of what we're dealing with in response to COVID-19? But really, it is those partnerships with the community that we fall back on. I said officers have to be a little bit more creative, a little bit better at problem solving. But what it comes down to is we know who to call for help. And that's going to be our domestic violence intervention program. And the bottom line is our history of working together so successfully over the past 20 plus years leads us to the point where we can be comfortable knowing that if we need to call for help, DVIP is going to be right there with us. But that's ultimately what talking about the grant, what it was is changing the culture. Again, we're in a community where we're lucky to have such strong relationships. That's what makes us good at what we do. Without those relationships, it just wouldn't happen. But I could go on about the grant, but really that's the big picture thing is a shift in culture, officers working a little bit harder to make sure people in our community are safe.
So far, we've been talking about victims and the offender. But if I have a friend or a family member, what could I do to kind of intervene or to support them if I think that they are in a situation that is, experiencing domestic violence?
Well, the first thing I would say is look for some information about safety planning and some ways that you might introduce safety to your friend or family member. On our website, www.dvipiowa.org, we have a whole range of materials, and they're all designed to help people connect where they need to. And so just feeling comfortable asking the question, do you feel safe right now? Are you okay? Are you okay telling me what's happening? But more importantly, once you ask the question, being willing to listen and hear the answer, and being willing to respect what that person says that they need at that time. Those are just so important. I think so many times we have an idea of what we think should happen or what you may personally want to happen, and that may or may not be a safe thing for somebody who is responding to violence in an intimate relationship. They know what their partner is capable of. They are constantly vigilant on what's happening within their home environment and making decisions on how to keep themselves safest. And so when you ask that question, are you feeling safe right now? If somebody says yes, tell them we've got a place you can call. There is a local hotline. There are people who can sit down and talk with you. If they say, yeah, I'm perfectly fine, or no, there's nothing going on, it's also okay to say, I'm really glad you're safe. I think that domestic violence happens so much that I think it's okay to check in on the people that we care and love to make sure that they're safe in their home.
Will you give us that information and where we can go again to learn more about the services you all offer so that people know how to really look at the resources and how that'll be impacted?
The hotline's the most important number. That's 800-373-1043. There's somebody there 24 hours a day that can help you just talk through it, answer questions. But our website is also just a really great receptacle of just information. And so the website address is www.dvipiowa.org. So dvipiowa.org.
Another service you're doing now during the pandemic is sheltering people. Talk about that. And what are you doing for your staff to keep them safe and the individuals that are utilizing the shelter?
Well, shelter in a pandemic has definitely been a challenge. It's something that we've been talking about across the country, about how shelters having community living spaces make it incredibly difficult to social distance and to diminish the nature of exposure to COVID. And so for us, we made a decision early on that we wanted to depopulate our shelter to the greatest extent that we can. That particular decision was supported by all of the national conversation and, more importantly, by our local conversation. We've been very lucky that our county emergency services, Johnson County Emergency Management, has recognized from the very beginning that shelters for individuals who are homeless and individuals who experience domestic violence are critical to keep right in the forefront. And so for us, we had about 35 people in shelter when this all got started, and we moved all of them in about 2 weeks. And that was a Herculean effort, I can say. We've been very lucky to have support through the city of Iowa City, Johnson County, through some hotels in the area, the Housing Fellowship, the Housing Trust Fund of Johnson County, and the Community Foundation of Johnson County in making sure that the individuals that we're supporting are in safe locations and are healthy. On top of that, of course, though, we've still had all of their needs to respond to, whether that be food, housing needs, whether that be individual resources like, for babies and for medical and all of that. And so our staff have been outfitted with PPE equipment through Johnson County and through some other resources and donations, and have been taking care of themselves, and really, really happy to say we've managed to keep our exposure and danger level on that count very, very low.
Well, it sounds like we're in this together is actually in practice by all the names of the partnerships that you all have created. 40 years in service has DVIP, and I know that this year you're celebrating your 40 years with the term 40 years in moving forward. Is that?
Yes. Yes,
so,
absolutely. 40 years forward.
40 years forward. So now that 40 years forward, you plan to have a celebration that has been postponed until fall. So sorry about that. The world is adjusting to postponements. I have my own personal experience of something major being postponed. But what I would tell you is this: people can still continue to celebrate in various ways with you all. One, certainly waiting until fall and see how that plays out. But
Yes.
with all the work that you have going on right now, we want to definitely share an opportunity for people to donate. Can you give us that information if they would like to support some of the efforts that you all are doing, which is pretty critical now, and not only now during the pandemic, but it's been critical for the past 40 years, the work that you all have been doing?
Thank you. Yes, donations are our lifeblood. Bluntly, we could not do anywhere near the work that we do, serving more than 1,900 people every year without donations and support from the community. When I mentioned moving 35 people, some of those were into hotels, but some of those were into apartments that were empty. And we've had tremendous support with donations of household goods, bedding, and kitchen supplies and things along that line to get people situated very, very quickly. Donations can be made online at our website, www.dvipiowa.org. There is a bar across the top of the page where it says where you can donate. And cash is certainly something that is helping us tremendously because it gives us a lot of flexibility in how we support people. If there are supplies that are specific culturally or physically and medically, we're able to respond to those quickly as needed. It also helped us with technology. We needed some very specific equipment in order to be able to continue providing services. So if you have items that you want to donate that you think can be used in your house, we could certainly use them in ours. Please don't hesitate to give us a call. We actually have a contact person, Ashley, and her number is 319-359-9353, and she can coordinate with you on a pickup or a drop off. We have a neutral location where items can be dropped off safely, and then we can pick them up later. Or like I mentioned, you can go to our website to donate there as well.
Well, thanks to both of you, both Sergeant Stevens and Kristie, for all the work that you're doing. And Sergeant Stevens, when I think about the work that the police department is doing right now, certainly there are frontline workers that have to respond to individuals that may be COVID positive, have symptoms, but they're responding, sometimes not even being aware if the individual has any of those symptoms. And if they're responding to an abuse situation, it really does just increase their risk. So thanks for all that you and the department is doing. Is there anything you want to say in these last minutes that we have together?
Sure, I appreciate that. I want people to know that the Iowa City Police Department will bring excellence in service. Not perfect, but excellence in service. You heard that in our mission statement. That's our motto. We understand and recognize that when law enforcement comes to a situation where there's domestic violence and we're intervening, that's a very dangerous time sometimes for victims. And what we do know also is that when a victim chooses to leave, that again is a very sensitive time, a very dangerous time. we're going to provide that excellent service. We're going to do everything we can to help them stay safe, give them agency, give them the ability to make decisions for themselves and their family in partnership with our community, whatever services that might be, especially like DVIP. But we'll be there for you. We're going to provide outstanding service to you, and trust us and call if you need help.
I would concur that anyone that is a victim or know a family member or a friend that has experienced something to this nature, feel free to reach out to Iowa City Police Department, because they will come realizing that this is a challenging situation and they're going to navigate it to the best of the abilities to really do the best for the victim. And then of course we have Kristie, who is, daily, dealing with this, with people that you serve. What are some final words you want to say to people out there?
I guess my final words are that there isn't anything you could do that makes it okay for somebody to hit you or abuse you in an intimate relationship. Violence is not a natural cause to anything. And so it's not your fault. The hotline is there for you to talk it through and figure out what your resources are and your support, because you deserve it.
Great. Thanks to both of you for joining me today on Community Connection, and I'll
You're
see you
welcome.
all later.
Sounds
Thank
good.
you.
Great.
Thanks so much.
Thank you both. That's our show for today. Keep up to date on city responses to COVID-19 by visiting icgov.org/coronavirus. I'll be back on Thursday with another Community Connection. I'll be speaking with the University of Iowa hospitals and clinics about their response efforts. You won't want to miss it. Until then, be safe, Iowa City.